We are living in midst of a deadly second wave. Numbers are up, beds are running out, oxygen in acute shortage. We look at some of those stories and also urge you to do your bit that you're not contributing to these numbers. I'm Sonal Mehrotra Kapoor, bringing you the breakfast news now. Centre says divert industrial use oxygen for COVID patients, prohibit oxygen for industrial use for the moment. Amid soaring COVID cases, Arvind Kejriwal's shocking claim says the quota for Delhi of oxygen is being diverted to other states. Also, NDTV learning from sources that the weekend curfew is likely to extend into the week. Important meeting at 11 a.m. this morning. Allow import of Remdesivir from Bangladesh. Jharkhand seeks permission to import Remdesivir. Maharashtra government accuses former BJP Chief Minister Fadnavis of attempting to stock up on the critical and crucial drug for COVID patients, which is currently in short supply. Remdesivir for party workers when sale is allowed only for the government. After Rahul Gandhi, now Mamata Banerjee takes note of COVID, cuts down her poll rallies to only 30 minutes across the state, and in Kolkata, there will be no further rallies for the Trinamool Congress. It was the deadliest day of the pandemic, with 1,500 deaths and the biggest daily surge. 261,500 infections. In Maharashtra, Delhi recorded their biggest ever single-day surge. Delhi reporting over 25,462 cases, 161 lives lost. Maharashtra over 68,631 infections, over 500 lives lost. The Delhi government is likely now to extend the weekend lockdown as well, as the national capital has been reporting a record surge in daily cases, and this is despite the night curfew, despite the weekend curfew. The decision is expected to be announced as a meeting will take place between the LG and the Chief Minister at 11 a.m. this morning.
The second wave turning worse. India recording its highest ever cases and highest daily deaths in the last 24 hours. The fourth consecutive day of India recording over 2 lakh cases. Daily cases jumped by almost 27,000 in the last 24 hours. This is the highest single day increase in cases. Daily deaths have increased by over 500% in just 1 month, from 172 a month ago to over 1,000 now. In the national capital, which recorded over 25,000 cases today, streets deserted due to the weekend curfew. But outside hospitals, a constant stream of ambulances and relatives waiting. 25-year-old Mohammad Arib lost his 60-year-old mother Saira as he ran from one hospital to another for a bed.
बहुत दिक्कत हुई, बहुत ज़्यादा। मतलब इमरजेंसी में जाके ना कोई फ़ायदा नहीं हुआ। प्राइवेट में बैठ नहीं थे। और सरकार ने गवर्नमेंट ने ये कह रखा है कि सरकारी हॉस्पिटल में जो है बेड्स अवेलेबल हैं, लेकिन जा तो कुछ होता नहीं है। इमरजेंसी में 3 घंटे लग गए तो पेशेंट कहाँ से स्टेबल होगी उसकी तबीयत।
Others cannot get oxygen, like 22-year-old Shubh, whose grandmother had to be admitted to LNJP hospital.
Oxygen concentrator, forget about rent, we are not able to buy also. There is, in Daryaganj, there are a whole lot of surgical shops. They are out of shortage. They are saying that the oxygen concentrators are imported. So they have no stocks. It is coming from China or America. So at least they are saying to wait for 2 to 3 weeks.
Delhi CM Arvind Kejriwal today wrote to the Prime Minister asking for more beds and oxygen. 99% of Delhi's ICU beds with ventilators and 98% of Delhi's ICU beds without ventilators were occupied by afternoon.
अभी पूरे दिल्ली का अगर जायजा लिया जाए तो जो कोरोना के लिए बेड रिजर्व हैं वो बेड काफ़ी तेज़ी से ख़त्म होते जा रहे हैं। ऑक्सीजन की भी काफ़ी कमी है ये हम लगातार केंद्र सरकार के संपर्क में भी हैं, उनसे भी मदद मांग रहे हैं, उनसे मदद मिल रही है।
This led the Delhi government to issue orders that all private hospitals and nursing homes would reserve 80% of their ICU beds and regular beds for Covid-19 patients.
More than a year of the pandemic, and yet India was not prepared for this. From basic hospital resources like ventilator beds to medical oxygen, India is struggling on every front. The government is promising that it is ramping up resources, but it will have to catch up very fast. In New Delhi with camera person Sushil Rathi, this is Sukirti Dwivedi for NDTV.
And we continue to keep our focus on the national capital, where the numbers are staggering to say the least. Well, the government, while it's still contemplating what to do with the lockdown, the Chandni Chowk Association over there, the Market Association, has decided to shut shops. And this was a self-imposed ban of sorts, a sort of repeat of what we saw at Hazratganj in Lucknow, another place which has become an absolute uncontrollable hub for Covid-19. Well, taking stock of this situation will be the Chief Minister in the national capital, and he will be meeting the Lieutenant Governor as well. That meeting expected at around 11 a.m. Sukirti now joins us to get an understanding of what exactly is expected. Sukirti, first, weekend curfew has been tried out, but numbers clearly not in control. What exactly are we expecting when Kejriwal meets the LG today?
Well, yes, this meeting is scheduled to take place at 11 a.m. and while a weekend curfew is already in place, there is a certain expectation that the Chief Minister might extend this curfew to weekdays as well. And that is likely to be done because the health infrastructure of the national capital is not in a position to deal with 24 to 25,000 cases on a daily basis. Already all of our beds are full. The government is rapidly trying to increase the hospital infrastructure by adding these additional facilities like CWG Sports Complex or schools where these oxygen beds are being set up. But these facilities will also take some time to become functional and to deal with the patient load. So at least for some respite to all these healthcare workers, because we can keep on adding beds, but a number of doctors and nurses are limited and they also need some time to deal with this entire extreme patient load at this point of time. So in order to keep that functional and ensure that hospital infrastructure is in sync with the number of patients that we are dealing with, the Chief Minister might think of this as an option. But everything is on the table at this point of time for consideration. All of this will be taken up in the 11 a.m. meeting. And soon after that, the Delhi government might make an announcement to the public of Delhi on what they finally decided.
All right, we wait to see what happens and what comes out of that meeting. 11 a.m., that's when the Delhi Chief Minister and the Lieutenant Governor will be meeting. It is important now because, remember, under the new law, the Chief Minister has to sort of communicate and get a go-ahead on all issues now from the Lieutenant Governor. So that crucial meeting is going to take place. We'll be keeping a close tap on that. Meanwhile, the other big issue in the country, supply of oxygen meant for industrial use will now be diverted to meet the rising demand for medical oxygen in the country as it battles a record surge in COVID-19 cases in a deadly second wave of the pandemic. Now, this is what a letter from the government to the chief secretaries of all states said. Amid spiraling coronavirus cases in the country, the demand for medical oxygen has gone up through the roof, and there have been reports of shortages of medical oxygen, and several states and territories have written to us, including Maharashtra and Delhi. The government's move has come and mostly aimed at plugging the oxygen gap in the country, particularly in the high-burden states. Meanwhile, Delhi Chief Minister Arvind Kejriwal alleged that the centre has reduced Delhi's quota of medical oxygen and diverted it to other states. He also wrote to the Union Minister Piyush Goyal alleging that 140 metric tons of oxygen meant for Delhi was diverted to other states and should be restored. The national capital, he said, is facing an acute shortage of oxygen and declared that the issue has become an emergency. The tweet on your screen right now. Meanwhile, there was a response that came in from Piyush Goyal, and he said that states, wait for it, should keep demand of medical oxygen under control. So the Union Home Minister, not the Home Minister, beg your pardon, Piyush Goyal over there, the Railways Minister over there, saying that the demand side management is important as supply side management and containing COVID spread is a responsibility of state governments. Don't believe me? Listen in for yourself.
रैशनल यूज करना पड़ेगा ऑक्सीजन, वेस्टेज रोकनी पड़ेगी। उस पे राज्य सरकारों को हमने अनुरोध किया कि वो उस पे भी थोड़ा नजर रखें, निगरानी रखें और डिमांड साइड मैनेजमेंट भी उतना ही इम्पोर्टेंट है जितना सप्लाई साइड मैनेजमेंट। और कोविड फैलाव को रोकना राज्य सरकारों की जिम्मेदारी है और उन्होंने इस जिम्मेदारी को पूरा करना चाहिए।
Shameful comments really to see the Lee, something the opposition has attacked the minister over as well. He said, Manish Tiwari there tweeted saying that even I was spokesperson of government as minister. I also defended what at times was indefensible. That was, however, political. Piyush Goyal, this passing the buck with great respect is morally repugnant, especially when people are dying, my friend, not expected from a cabinet minister. Meanwhile, at least 10 COVID patients have reportedly died due to low pressure in liquid oxygen tank at a government medical college in Madhya Pradesh, Shahdol district. The district administration has confirmed the deaths but denied the unavailability of oxygen as the cause.
The morning after, 10 COVID patients died during the night, allegedly because they couldn't get oxygen. Relatives say that the oxygen pressure dropped in the COVID ward at the Shahdol Medical College, which had 62 patients in ICU and 10 of them died.
ऑक्सीजन का लेवल देखा तो 91% पॉइंट आ रहे थे पल्स के और सुबह 4 बजे हल्ला हो गया कि ऑक्सीजन नहीं है और हम अंदर जाना चाहते रहे, नहीं जाने दिए। जब किसी तरह से हम अंदर गए तो देखे तो बॉडी ठंडी थी और एक नहीं कई बॉडियां इस तरह की हैं और पूरी लापरवाही शासन की है।
12 बजे के बाद हम लोग खाना पीना खिला के अच्छे से सुला पड़ा के गए हैं। उसके बाद यानी जब सुबह 6 बजे पता चला कि वो सब डेड हो गई। उन्होंने गार्ड से पूछा तो बोले रात में सिलेंडर खत्म हो गया था।
In 25 hours, 12 COVID patients died at the Shahdol Medical College, but hospital and district administration said low oxygen was not the cause, as they had brought in jumbo cylinders.
आज हमारे यहाँ जो हमारा लिक्विड मेडिकल ऑक्सीजन प्लांट है, उसका जो लिक्विड ऑक्सीजन आता है पूरा खत्म हो गया। उसके कारण ऑक्सीजन सप्लाई जो चल रहा है उसके दबाव में कमी आई। लिक्विड ऑक्सीजन की डिमांड बहुत पहले से चली गई थी। कल शाम तक टैंकर आ जाना था, कल शाम को नहीं आया। फिर पता चला रात को 2 बजे आएगा, 2 बजे भी नहीं आया। फिर तब तक इसका लिक्विड ऑक्सीजन पूरा खत्म हो गया। सुबह वो गाड़ी चालू हो चुकी है वहाँ से करीब 6 बजे और 11 बजे तक वो आएगी। अभी भी हमारा ऑक्सीजन सप्लाई लगातार जारी है। ICU में हमारे 62 मरीज एडमिट है। इसके अलावा प्राइवेट रूम्स हैं, वहाँ पे भी ऑक्सीजन पॉइंट है, उसमें 25 बेड पे भी पेशेंट रखे हैं।
हमने तत्काल उनको बताया कि डिस्ट्रिक्ट हॉस्पिटल में हमारे पास बैकअप उपलब्ध है। उसी समय मेडिकल कॉलेज को हमने डिस्ट्रिक्ट हॉस्पिटल से बैकअप भेजा।
Chief Minister Shivraj Singh Chauhan has said the supply of oxygen is fast returning to normal. Consumption is 335 metric tons and they have 350 metric tons. But the BJP leaders had photo ops with oxygen cylinders at 2 places in Indore. The Congress has asked the ruling party to take responsibility for the deaths at Shahdol.
इस संकट का समय यदि आप ऑक्सीजन की श्रेय लेना चाहते हैं तो जो ऑक्सीजन की कमी के कारण इंदौर में मौतें हुई हैं उसका श्रेय भी लीजिए। क्या आप उन मरीजों के घर गए? क्या उन मरीजों का दुख दर्द जाना जिनकी मौत ऑक्सीजन के कारण हो रही? क्या आप उन मरीजों का दुख दर्द जानने गए जो रोज ऑक्सीजन सिलेंडर लगाए अपने घरों में इलाज करा रहे हैं क्योंकि अस्पतालों में बेड नहीं मिल रहा है? अस्पतालों के बाहर ऑटो रिक्शा से लेके वाहनों के अंदर सवार हैं, मुंह पे ऑक्सीजन लगाए हुए हैं और इंतजार कर रहे हैं कि उन्हें बेड मिले। क्या आप कभी उनके सुख दुख में शामिल हुए जो आप इवेंट बना रहे हैं?
The state is counting its breath, but our politicians are busy in making media spectacle out of everything. The Chief Minister has claimed a surplus of 15 metric ton of oxygen as on date and the availability of 700 metric ton of oxygen by the end of this month. But the reality is heart-wrenching. Lack of oxygen has claimed lives not only in Shahdol but in Indore, Khandwa, Ujjain and even state capital Bhopal. With Vinay Tiwari in Shahdol and camera person Rizwan Khan in Bhopal, Anurag Dhwari for NDTV.
There is shortage of oxygen. There is also shortage of the Remdesivir, which is said to be an important drug while treating people with COVID, but it's used only once it reaches a later stage. Now, with that shortage in mind, the Jharkhand government has now written into the centre saying that the country should allow the import of Remdesivir. The Jharkhand government has sought a nod to import it from Bangladesh. Chief Minister said have reached out to the pharma companies in Bangladesh and need to buy around 50,000 vials. With an increasing demand for Remdesivir for critical patients in Jharkhand and its unavailability, we have reached out to these pharma companies in Bangladesh for buying around 50,000 vials for emergency use. I have written to Mr. Gowda for permission to import ASAP. And if you still need a grim reminder of how serious the second wave has become and how deadly it is really this time around, take a look at these pictures. We got these from a crematorium in Ghaziabad. There is a waiting, even if you want to take somebody inside and perform the last rites. You see families after families lined up over there, waiting in queue. Their bodies simply lying on the pavement or footpath of that crematorium. You see cars passing by and you see lives being lost in this battle against COVID and just stuck over there.
पूरे गाजियाबाद में कोविड के बेड की संख्या है 1856। अभी जो मरीजों की जो सक्रिय मरीज हैं गाजियाबाद में, वो सरकारी जो आंकड़े हैं, ये 16 तारीख के हैं सरकारी आंकड़े कि 2260 मरीज हैं, यानी सक्रिय जो मरीज हैं गाजियाबाद में वो 2260 हैं। 100 से ज़्यादा लोगों की अब तक मौत हो चुकी है और 2260 सक्रिय मरीज हैं। तो ऐसे हालात में आम आदमी तो अब घबरा ही रहा है, साथ में जो सरकार में सत्ता में बैठे हुए जो मंत्री और सांसद हैं, उनके अंदर भी कहीं ना कहीं इस बात का डर है और चिंता भी है कि अगर इसी तरीके से केस बढ़ेंगे तो आखिर स्वास्थ्य सेवाएं जो है वो किस हद तक लोगों को मुहैया हो पाएंगे।
You clearly don't want to be one of those standing over there. So do your bit. Wear your double masks and do not go out unless absolutely necessary. Quick break. Back in a moment.
Prime Minister Boris Johnson is meant to be in India over the weekend, the 25th of April to be precise. The agenda for the meetings between the two counterparts in India and the UK, Prime Minister Narendra Modi as well as Prime Minister Boris Johnson, is defence and strategy, technological collaboration and most importantly trade and investment talks between the two nations post-Brexit. If this trip were to go on, it would be Prime Minister Boris Johnson's first trip to any country outside the European Union since he came to power in December 2019 and since Brexit was officially pressed into action and into effect. The Labour Party is asking now why these meetings cannot happen online. There is mounting pressure on Boris Johnson to cancel his proposed trip to India given the precarious surge in the number of COVID-19 cases. Scientists have warned that the double mutation virus is extremely infectious and that there are already cases being reported in the UK after frequent and recent travellers brought it in to the United Kingdom. At the moment, the UK is only now coming out of a second prolonged lockdown which was pressed into effect in Christmas after a huge surge in the number of cases. Pubs, non-essential shops recently opened up on the 12th of April and there is a plan to open further in UK out of its lockdown in May, on the 19th of May to be precise. Several scientists have warned that the UK could be staring at a third wave which at this moment it cannot afford. There is also mounting pressure on adding India to the travel red list in the United Kingdom. What does this red list mean? It means that if India were to be added to the red list, then any traveller coming into the United Kingdom from India would have to hotel quarantine himself or herself for 10 days. At the moment, people are required to quarantine within homes. People are also at the moment from the UK not allowed to travel outbound, particularly for holidays, unless of course they have a very pressing reason why they should, whether for work or for personal emergencies. The indication from the High Commission of India recently is that the trip is very much on. It will be interesting to see whether number 10 further now shares any communication to share whether the Prime Minister, Mr. Boris Johnson, will continue his trip to India as scheduled. Radhika Iyer from London, NDTV.
It started with Rahul Gandhi suspending his public rallies in Bengal, and finally the issue of COVID seems to be finding a political impact. Next up is Mamata Banerjee, who has said she will not campaign in Kolkata at all, and all the other rallies in the states will now be brought down to just about 30 minutes. This at a time when West Bengal is recording over 400 cases in just a single day.
The COVID crisis has finally muscled its way center stage in Bengal as it enters the slog-overs phase of the polls. Rahul Gandhi has cancelled all future rallies in the state. He has come to Bengal only once so far and held 2 rallies. Perhaps due to that, or to rising COVID numbers and rising public anger at politics in the times of the pandemic, Amit Shah was seen wearing a mask, and correctly, perhaps for the first time on a roadshow in the state. He held 2 of them today. In the second, the mask had slipped a little. But in his public address, COVID escaped attention entirely. His full focus, Mamata Banerjee and 2nd May.
जोर से बोलिए करनी है ना ये सिंडिकेट सरकार चाहिए क्या कटमनी सरकार चाहिए क्या घुसपैठ कराने वाली सरकार चाहिए क्या शरणार्थियों को नागरिकता न देने वाली सरकार चाहिए क्या
Between a wheelchair padayatra in South Kolkata and 4 public meetings in 2 districts, Mamata Banerjee wrote to the Prime Minister on COVID. She demanded urgent supplies of vaccines, medicines and oxygen cylinders. As COVID numbers have increased sharply, she admitted, though she blamed outsiders, read the BJP, for importing the virus.
Injection দিচ্ছ না কেন ইনজেকশন দিতে তোমার কি গায়ে লাগে ইনজেকশন নেই ওষুধ নেই আজকে মহারাষ্ট্র গভর্নমেন্ট বলছে ওষুধ নেই আজকে আমরা বলছি ওষুধ নেই সব বহিরাগত কোভিড নিয়ে এসেছে আর এখানে কোভিড ছড়িয়ে দিয়ে সব চলে যাচ্ছে প্রধানমন্ত্রী খেয়ে দেয়ে কাজ নেই কোথায় কোভিড দেখবে তা না বাংলাকে করে দখল করা যায় তার জন্য প্ল্যানিং করছে
Bengal's COVID numbers are spiraling. Yesterday, over 7,000 new cases and 34 dead. The rate of growth since 1st April, say experts, is just a little below Delhi's. A task force of senior state officers is trying to fix the problem of Kolkata hospitals running out of beds. 3 phases of polls still left. Fears growing about the crisis turning deadly after they end. In Kolkata, Mamata Banerjee, NDTV.
And in Rajasthan, some curbs have been put into place as well. 15-day lockdown to be called self-discipline fortnight as well. Now, all markets, restaurants, non-essential shops to remain shut. All offices to remain shut till 3rd of May. Essential services to remain open at this time, though. Let's look at other states now. Let's begin with Maharashtra, where the Mumbai police on Saturday night questioned a pharma company director following information that thousands of vials of the Remdesivir drug critical in coronavirus treatment and in huge shortage across the country had flown out of the country. Controversially, in a late-night drama, opposition leader and former Chief Minister Devendra Fadnavis arrived at the police station to say that the permission were in place for the purchase of an antiviral drug. The NCP is now asking, how did a private individual like Fadnavis procure Remdesivir when the sale of this drug is now allowed onto the government only to prevent any sort of black marketing? Here's the report.
Former Maharashtra Chief Minister and leader of opposition in the state, Devendra Fadnavis, at the BKC police station late Saturday night, intervening after the Mumbai police detained Brook Pharma owner Rajesh Dokania, who was allegedly moving a truck with 60,000 vials of Remdesivir, a crucial drug for COVID patients which is currently in short supply. Fadnavis told the police that it was he who had requested Union Minister Mansukh Mandaviya to supply Remdesivir to Maharashtra.
4 दिन पहले हमारे विधान परिषद के विपक्षी नेता प्रवीण दरेकर और विधायक प्रसाद लाड़िए दमन में गए थे। ब्रूक फार्मा में जाके उन्होंने वहां पर उनको निवेदन किया कि आपका प्रोडक्शन आप महाराष्ट्र को दीजिए। उन्होंने कहा कि प्रोडक्शन कर सकते हैं, लेकिन हमको एक्सपोर्ट का लाइसेंस है, जब तक हमको परमिशन नहीं मिलती तब तक हम ये माल नहीं दे सकते। तो मैंने स्वयं फिर केंद्र सरकार में आदरणीय मनसुख भाई मांडविया जी से बात की। मनसुख भाई मांडविया जी ने उनका टाइप रेड्डी से कर दिया ताकि उनके लाइसेंस पर ये प्रोडक्शन कर पाए।
हम गुड फेथ में एक्ट किया है और उसका इंफॉर्मेशन को वेरीफाई करने की कोशिश कर रहे हैं, और जो भी ऐसे स्टोरेज करने के लिए इलीगली जो रख रहे हैं उनके ऊपर हम डेफिनेटली लीगल कार्रवाई करेंगे।
Cabinet Minister Nawab Malik questioned Fadnavis's motives and defended the police action.
जब कोई पूछताछ चलती है तो नेता विपक्ष के दोनों नेता, उनके विधायक पुलिस स्टेशन में जाके अधिकारियों से सवाल जवाब करने लगते हैं। क्या कनेक्शन है भारतीय जनता पार्टी का?
But another cabinet minister, Aditya Thackeray, says the issue should not be politicized.
Where we are trying to restrict hoarding or black marketing of Remdesivir, I think everyone, all of us as political parties should come up, work together for the state and the country today. We cannot be taking individual credit for who got these vials, from where we got these vials, and we're giving it to the government or the people. I think it's for all of us to really be responsible right now, step up above politics.
The state is facing a shortage of oxygen beds and crucial medicines, but the state and centre are trying to politicize the issue. The need of the hour is for the government and opposition to come together and work and save people's lives. In Mumbai, this is Purva Chitnis for NDTV.
Fresh curbs have been put in place across the country in metros, in capitals, where there is a massive outbreak at the moment. Delhi has just witnessed its first weekend curfew in the second wave this time around. And today morning, in about 2 hours from now at 11 a.m. is when there will be a crucial meeting between Arvind Kejriwal, the Chief Minister of National Capital, and the LG. The agenda, how to curb the numbers. Now, Arvind Kejriwal has been talking about how he had earlier said that he is not in favor of a lockdown, but if numbers, if they do not come under check, he will be left with no other option. And numbers have only gone up even through the weekend. Sunday was one of the deadliest days in the national capital. The numbers at a peak as well. So what option is really there in front of the Chief Minister? Let's find that out with Sukirti Dwivedi. Sukirti, we've been reporting through the weekend. You've been talking about how when even the curfew was on, all one could really hear was the sound, the disturbing sound of the ambulances. All of us driving to work have witnessed the same. And now, as we get into this week, where numbers clearly not under check, deaths clearly not under check, beds not available, oxygen in short supply, how is the Chief Minister likely to address this?
Well, at least one option on the table right now is whether this weekend curfew should be extended to weekdays as well. Mr. Kejriwal has never been a supporter of the concept of lockdowns. He has always said that when you impose a lockdown, people's livelihoods are affected. So that is never the ideal option. But given the spike in cases, given the 24,000 to 25,000 cases that we are seeing with each passing day, it is becoming very difficult for Delhi's hospital infrastructure to deal with this. For example, if the government on any day decides to add 4,000 beds or 5,000 beds, but if they are dealing with 25,000 additional cases, then the hospital infrastructure just can't catch up fast enough, and that is the problem at this point of time. So something even doctors have been saying yesterday. Even the chairman of Sir Gangaram Hospital said that at least for 1 week we should have a lockdown in place, so that at least our hospital infrastructure can cope up with the patient load that they already have and not even the additional cases. So that is what the Delhi government is looking at. There are sports complexes, schools, banquet halls, hotels where new additional medical setups are being created, yet all of it is falling short, and that is why today in 11 a.m.'s meeting, this could be a possibility that will be looked at. This will be considered whether a week-long curfew should be imposed, and post that around 12 or 1 p.m., which is usually the pattern, the Chief Minister might address a press conference to announce to the public of Delhi what has been finally decided.
All right, so that meeting at 11 o'clock, so far we don't know. The press conference has not been called, so we don't know what's really coming our way, but all indications at the moment that there could be a likely extension of this lockdown from the weekend going into the week as well. Thanks, Kirti, for joining us with the very latest. Well, there is shortage of beds, and the biggest crisis at the moment, shortage of oxygen. And Arvind Kejriwal, in fact, made a staggering claim. This claim comes at a time, we'll talk about that in just a bit, but these pictures on your screen are of actually the centre writing into state governments and saying that stop use of any industrial use of oxygen and divert all of that to COVID patients. This comes at a time when several parts of the country, the worst hit states specifically, reporting an acute shortage of oxygen. And in the middle of that, the Delhi Chief Minister alleged that centre has reduced Delhi's quota of medical oxygen and diverted it to other states. He also wrote to Union Minister Piyush Goyal alleging that 140 metric tons of oxygen meant for Delhi was diverted to other states and should be restored. The national capital, he said, is facing an acute shortage of oxygen and declared that the issue has become an emergency. In fact, meanwhile, Piyush Goyal has said that states should keep demand of medical oxygen under control. He's saying keep the demand under control.
Rational use करना पड़ेगा oxygen, wastage रोकनी पड़ेगी. उस पे राज्य सरकारों को हमने अनुरोध किया कि वो उस पे भी थोड़ा नजर रखें, निगरानी रखें, और डिमांड साइड मैनेजमेंट भी उतना ही इम्पोर्टेंट है जितना सप्लाई साइड मैनेजमेंट. और कोविड फैलाव को रोकना राज्य सरकारों की जिम्मेदारी है और उन्होंने इस जिम्मेदारी को पूरा करना चाहिए.
Shocking statement really from the Union Minister, saying the demands should be handled and that it's states' responsibility to take care of COVID numbers, passing the buck at the worst possible time, really something that has been picked up by the opposition as well. Manish Tiwari tweeted saying that even I have been the spokesperson for government as a minister. I have also defended what at times was indefensible. That was, however, political. Piyush Goyal, this passing the buck with great respect is morally repugnant, especially when people are dying, my friend, not expected from the Union of India Cabinet Minister. All these statements coming at a time when, look at the numbers, highest ever for Maharashtra, 68,631 new cases, 503 deaths reported in Maharashtra on Sunday. The state has recorded over 67,000 cases on Saturday and about 8,400 cases in Mumbai alone. 53 lives lost on Sunday. And let's look at some other states now. 6 states, Kerala, Goa, Rajasthan, Gujarat, Delhi, NCR and Uttarakhand have been declared as places with sensitive origin by Maharashtra government. Train passengers coming from these states will have to get an RT-PCR negative test within 48 hours of travel. No reserve ticket for Maharashtra should be issued on trains for sensitive origins, and if passengers are not carrying the RT-PCR negative report, they will have to undergo a rapid antigen test at the station. And every passenger with COVID-19 positive result or with symptoms or refusing to undergo screening shall necessarily be moved to the quarantine centres. All passengers without symptoms will be stamped on their hands for compulsory home quarantine for 15 days. And this is required for those passengers, those who are carrying negatives as well. They will also be stamped. And all this is coming at a time when there is an acute spike, in fact, in increasing numbers really across the country. All passengers without symptoms will have to undergo 15 days at home quarantine, and those with symptoms, positive result, will be sent to institutional quarantine facilities. Just to remind those states really for you, which are these 6 states? It is states like Kerala, Goa, Rajasthan, Gujarat, Delhi, NCR and Uttarakhand as well. But staying with news from Maharashtra, sanitization conditions at the Mulin's Jumbo Center is quite bad. People have been sending these videos from the Jumbo Center. A woman patient was facing issues at the most over there, as she talked about no lights or even latches available in the washrooms. Desperate times really calls for desperate measures. But what are these measures? Let's take it forward with our guests. We've got Dr. Dhamija joining us, Professor and HOD for Neurology at the Lady Hardin Medical College in the National Capital. He's a WHO Fellow as well. Thanks for your time this morning, Doc. And Dr. Anand Rao as well, Consultant Cardiologist at the Holy Family Hospital in Mumbai. Let me begin by bringing in a word from Dr. Dhamija. We have a meeting in less than 2 hours from now where the Chief Minister will meet the LG, and they are likely to discuss on how to really contain this massive second wave, this deadly second wave in the country. If you were put in the decision-making chair right now and you had to control these numbers, what would you do?
Thank you, Sonal, for having me in your show, and good morning to all of you. Sonal, it's a challenging time. These are challenging times. We are in a difficult time. There is a crisis, no doubt about this. A virus is rampant here and virus is here to stay. So we need to be more vigilant than ever now. But let me put these things into perspective. How did we land up here? How did all these things happen? So the people's behavior has changed. That's number one, change in behaviors. Whether people, even the vaccinated people started, not using masks, and the lack of COVID appropriate behavior was increasing as the numbers went down. So obviously in the month of January, December and January, when the infections were low and the vaccines were on the horizon, so people thought the pandemic has gone, and this led to complacency on the part of the people. So that's number one. The number two is the change in behavior of the virus also, with the more virulent second
Dr.
wave.
Dhamija, can I intervene here? Can I intervene and say that we've been talking on these lines for quite some time now. Yeah. We've talked about how people behavior has changed, virus has mutated. But what about rallies? What about the Kumbh Mela?
I'm coming to
Shouldn't there be, aren't doctors like you angry at this point at how decisions have been taken in the country?
Absolutely. The third point which I was going to mention was this avoidable mass gathering, which even a single infected asymptomatic person can infect a large number of people. In fact, I had written yesterday also in the newspapers that the gatherings, whether it is a political rallies or the religious rallies or social functions, they need to be stopped immediately. And these people who are coming from these mass gatherings and going to smaller towns and cities, they would be carrying probably a virus.
But that's now done. What do we do now?
Yeah. So
that's happened. Nobody controlled it then.
Yes. So now we can do is at least we can quarantine them. That's number one. At least self-isolation for 1 week minimum, at maybe 2 weeks. The second is these people should be subjected to aggressive testing. Once you become aware of your infection status, you tend to become more vigilant. You tend to try to adhere to the precautions or public health measures. So it's always better to do the testing for all these people who are coming back to their towns. And third is, of course, the backward contact tracing. That is very important to contain further spread of the virus.
All this has to be done. But the reality in Delhi, people are getting their test results in 4 days, 5 days.
Yes, I'm coming to Delhi
there
also.
There is simply no, forget beds and oxygen at this point, which is anyways in short supply, and we are seeing lives being lost by the minute. But even something as basic as testing is not available right now.
That's what I told you in early my opening statement, that these are difficult times, and the consequences of this has two folds. One is that the health infrastructure is likely to collapse with these numbers and with these these avoidable gatherings and all these multiple factors. So that's number one, the public health infrastructure tends to collapse. And second thing is your first question, what would I do, or what would the stakeholders should be doing it? So there are two indications for the stay-at-home orders. One is that once your numbers are increasing at a skyrocketing like this one, the unprecedented rise in numbers, every day we are seeing the peak. I predicted 200,000 at the end of this month, but we're already now to 275,000, 275,000 in the 3 weeks. And second is positivity rate. So it's already touching 30% in Delhi. So these two indications are for a strict stay-at-home orders, and I believe that that's going to happen in 2 hours' time from now.
Strict stay-at-home orders. That's the appeal coming in from Dr. Dhameja. Let me bring in Dr. Rao as well. Dr. Rao, let me just cut to the chase over here. Who do you hold responsible for the current condition?
Good morning, Sonal, and thank you for having me over here. Well, the responsibility lies with everyone. As Dr. Dhameja has mentioned, we put our guard down in January, February. The mutation of the virus, the religious gatherings, plus the political gatherings, all has sort of been a good recipe for us. And now we're in a situation where the positivity rate has gone up to 30%. As I talk to you right now, Maharashtra has contributed 1 million cases in just 18 days. If you look at the last million, it took us 124 days. Now we have contributed 1 million cases in just 18 days. And the positivity rate is going up to almost 30%. So this is the real point of concern. Now it is actually like a bushfire which has spread very wide. Now we have to take aggressive steps. Even lockdown is not the answer at all. I think we have to.
We couldn't hear you there. Doctor, could you come again? You're saying what is not the answer at all?
Mere lockdown is not the answer at all.
Okay.
We have to do strict contact tracing. We have to implement a lot of other appropriate behavior, masking, and so on and so forth. Without this, I think, it will be very, very difficult to control. One point, Sunil, I want to highlight is about important point about vaccinated individuals. What's happening is the people who are partially vaccinated, the virus is sort of getting mutated because of partial vaccination, and this mutated vaccine is finding susceptible host to spread the disease. So I think
could you explain that? You are saying people who are partially vaccinated, meaning people who've taken the first jab, which is mostly the case of people who took Covid-19, because the window between the two jabs was increased. You're saying what is happening with the virus there?
So what happens is when there is partially vaccinated individuals, the virus sort of looks for new mutation, and then it looks for susceptible individuals who are not vaccinated, and that sort of compounds the problem which is already occurring. So the point I'm trying to make is you have to scale up your vaccination program. You have to sort of drop your eligibility criteria to younger individuals who are otherwise are super spreaders. So all these points have to be taken into consideration to sort of reduce the transmission and to contain this virus.
Dr. Rao, what you're saying is very worrying. What you're saying is extremely worrying right now. I'll get Dr. Dhameja to quickly respond to that also. Dr. Dhameja, is that your view as well?
No, I think we need to focus on vulnerable group. The data is clear about the Covishield vaccine, Oxford vaccine, and the data of 3 different trials, 4 weeks, 8 weeks, and 12 weeks, was in the favor of 8 to 12 weeks, and we have done the right thing. That's not the issue. That even the first dose will give protection, and in the meantime, many more individuals can be immunized if the gap between first jab and the second jab is increased. So I'm not concerned about that. But other point I want to bring in is, Sonal, that the last time the people who could isolate themselves, who could protect themselves from the virus, and these are the young people actually, and they are not vaccinated as of now. So they are the individuals now getting the jab, they're getting the infections. And they are the most vulnerable group because they are moving in and out, and they could protect themselves last time.
For weeks we've been saying this. For weeks, doctor. The fact is there are no vaccinations. We've fallen short in that as well, because India at a time when we really needed to push our vaccination system was exporting vaccines. That is the hard reality. Quick word after wrap, Dr. Rao now.
Regarding vaccination, if you look at the statistics, 32% of the population in the United States has been vaccinated, 47% in UK, and India, 5% is on the number who have been single vaccination. So it's a point that we should expand our vaccination coming from abroad.
We should, but can we at this point?
The government should start doing it. I mean, we cannot, with 2 vaccines in our country, we cannot suffice this mammoth population. So I think more vaccine types should be welcome to countries. There was a good diplomatic tie of 65.5 million vaccines exported. That was a very good sort of government stand, but we should start cleaning our states and our state itself to get more vaccines in, and so that we can address this large population.
I think the problems are known, the solutions are known as well. Why are we just sitting on it? It's so frustrating to look at all these pictures, to hear your family, one phone call after the other, all of them just contracting the virus one after the other. It's so difficult to look at these SMS and SOS calls being made by people all the time. What exactly is the government waiting for? I really fail to understand. For the moment, we leave it there. Dr. Rao and Dr. Devita, thanks for your time. We're going to slip into a break. Back in a moment. The latest COVID figures are in. It's a new day, a new hike. India has reported 2,73,810 positive cases in the past 24 hours. It's the highest ever. The deaths, 1,619. That is the highest as well. India at the moment, the past 24 hours have been the deadliest and have got the maximum cases in a single day. All this is happening as we continue to see cases come up from all parts of the country. Over 2 lakh cases is what India has reported repeatedly, and this is now going on for the 5th consecutive day where India has reported over 2 lakh cases. Sukirti Dwivedi joining us with the very latest. Sukirti, new day, new hike, maximum cases, maximum deaths.
Well, yes, the situation continues to be concerning with each passing day. A jump of about 12,000 cases from yesterday. Yesterday we had about 2,61,000 cases. Today we have 2,73,000 cases. Deaths have gone up from 1,500 or so yesterday to about 1,600 today. And of course, the biggest worries being states like Maharashtra and of course the national capital, where the Chief Minister is also set to hold a crucial meeting today, and there are chances that the curfew in the national capital could go on for a longer period than just the weekend. So at this point of time, India's hospital infrastructure across the country struggling to deal with the patient caseload. Today we've also had this letter from the Indian Medical Association. They've urged the government to expedite some of the exams that were planned to happen later. The Indian Medical Association is also saying that the hospital infrastructure across the country is crumbling at this point of time, and we are in desperate need of additional healthcare workforce. Certain examinations that were supposed to happen later should be conducted much sooner so that a lot of these medical students can join the workforce. They can help in all of these COVID-dedicated hospitals across the country that are working day and night at this point of time. So on one hand, we have record highs of COVID cases and deaths, and on ground the situation is that there are desperate needs and desperate families searching for hospital beds from pillar to post. Government adding those hospital beds in banquet halls, schools, everywhere possible. Yet we are falling short, and that is why the central government also saying that they are also ramping up resources, but situation continues to be worrying on ground.
It's an emergency at the moment in various parts of the country. The numbers are just give away on that. The highest number of cases since the onset of the pandemic in a single day. Highest deaths as well. Let me just repeat those numbers for you over there. 2,73,810 in one single day. Over 1,600 lives lost in one single day. It is perhaps because of these escalating figures now that Hong Kong has banned all flights from India for 14 days after dozens of passengers reportedly tested positive in Hong Kong after flying in on a Vistara flight from New Delhi on the 4th of April. While some reports suggest that 47 passengers who flew in on that flight tested positive, many during that mandatory quarantine period. Vistara has only issued a broad statement referring to the situation. It reads, and I quote from there now, Vistara ensures strict compliance with all guidelines issued by the Indian government as well as the destination countries. Authorities for all flights, including all charter flights to and from Hong Kong, will continue to be guided by any new requirements that may be introduced, courtesy the Vistara spokesperson. We are joined now by Danny Lee, the senior reporter of aviation for the South China Morning Post. Thanks for your time, Lee, over there. Could you just take us through what exactly happened on that flight and what is the news, at least in Hong Kong for the moment?
Yeah, that's right. Thank you for having me. So the Vistara flight in question arrived on April 4th, but now, more than a couple of weeks in, we have the authorities have found 47 COVID infections linked to this flight. The vast majority, I think we're talking about 36 or so, have been detected on the 12th day of hotel quarantine. Now, it's important to point out that Hong Kong has some of the strictest travel measures of anywhere in the world. You have to undertake 21 days of quarantine, and you are required to undergo at least 4 rounds of COVID testing over the 3 weeks. Now, this is where during the testing regime that the number of COVID infections have been detected many days post-flight. There is no suggestion that Vistara are at fault here. I think the authorities are rapidly looking at what went wrong, if anything, during hotel quarantine, because as we've seen that there is a concern over COVID variants which are more transmissible. And I think this is something that the Hong Kong authorities are very concerned about. And I'd just like to point out that it's not just this Vistara flight which is of concern. There was a new COVID case which emerged in Hong Kong over the weekend, which appeared to be linked to a mutant strain, and this is what has got the authorities very worried. So the action taken against India is more broad than that. The Hong Kong authorities are trying to get to grips with a mutant strain, the first time a mutant strain has been found in the local community.
And Danny, just for the benefit of our viewers, when you take that flight, you are expected to undergo an RT-PCR test. And it's only when you have a negative report do you get on that flight. But an incubation period of 12 days, that's news even for us in here.
I mean, it's well established that the incubation period can last weeks at a time. And this is why Hong Kong had extended the hotel quarantine where you're separated from the local community for 3 weeks. So we took that Hong Kong took that as an abundance of caution. Other countries have taken less stringent measures, shall we say.
That includes India, by the way.
There we go. And obviously, it's very sad to see a record number of deaths and infections as well. And it contrasts with Hong Kong, who've largely got the pandemic under control. We're reporting tens of cases a day, low tens of cases, and most of them are importations. So what Hong Kong is doing is trying to tackle the problem at source. And I just want to give you a quick statistic here. In the past month, of 231 importations, 75% of those infections have come from passengers coming from India, Pakistan, and the Philippines, who are the 3 countries which are responsible for the new flight bans announced on Sunday night in Hong Kong.
Wow, that's a huge percentage over there. So thanks, Danny, for putting that in perspective for our viewers. We leave it there for the moment. Good day, good luck, and stay safe for all of you over there as well.